Bert Knitter, I'm with the National Association for Health and Fitness. The programs that we're familiar with that have worked the best in wellness are ones that have professional leadership, full-time leadership that is there. In other words, a company employee that runs wellness programs that has a background in that area. And that person is there every day, and people can relate to them, and they can provide the leadership, as opposed to like somebody that just goes out and buys a health risk appraisal from one vendor and a well coach from another vendor and something else. There's no continuity and there's no presence there. Have any of you found that that's in fact true with the programs that you've looked at?
I think it's good stuff and it makes good sense. But when we try to make claims about sort of how prescription medications help, I'd say we're not going to do any sort of internal studies. They all have to be peer-reviewed, published if we're going to be basically sort of touting them. And the problem with this stuff is just that there's not a lot of good sort of peer-reviewed material like this particular thing. Do you have a professional fitness trainer? Is that actually going to sort of lead to sort of substantial improvement in wellness? It seems like a good idea, but annals of healthcare are full of things that seem like great ideas, but then when you do really serious studies of them, they don't turn out to have much effect. And I think we're kind of at the point now where we can say, we're not sure what works. Anybody who comes in and tries to pitch me a wellness program and says, I'm sure about this, I say, show me the data. And it's got to be peer-reviewed data, and it's simply not there. Would you sort of say? And I think, that's what Soren and the RAND team came up with. We're waiting 2 years for that study to come out. So I'd say we're getting to a point with these wellness programs where we got to about 3 years ago with disease management, which is that they seem like a good idea, but it sure is difficult to get sustained information about how well they work.